Hello everyone, today we will talk about the 21 Problems of Nursing by Faye Glenn Abdellah. Faye was born on March 13, 1919 in New York City. Her parents, Namadi Ben and Margaret Abdellah, immigrated from Algeria and Scotland and met in the United States. Her father was a chef and a restaurant owner, and her mother was a homemaker. In 1937, when Faye was 18 years old, she had an experience that would change her life forever. She and her brother Hamadi witnessed the fiery crash of the German passenger airship, the Hindenburg, and saw the burned victims who escaped. She felt powerless to help them and vowed that she would never again be unprepared when someone needed her help. It was then that she decided to become a nurse. Dr. Faye Abdellah is one of the leading nursing theorists and a pioneer in nursing research. She created a revolutionary nursing theory that helped transform nursing care and education. Her more than 150 published works are valuable resources in the world of nursing. In 1942, she graduated from the Anne May School of Nursing, Neptune, New Jersey, with a diploma in nursing. The school was later renamed the Riley Fitkin Paul Morgan Memorial Hospital School of Nursing. She could have worked as a nurse at this time, but she believed that nursing practice should be based on research rather than just hours of care. From 1942 to 1944, she continued her education at Rutgers University, New Jersey, where she studied chemistry. In 1945, she earned a Bachelor of Science in Nursing from Teachers College of Columbia University in New York City. During this time, she was the manager of a primary care clinic at the Child Education Foundation in New York City, and also was the manager of the Obstetrics Gynecology Nursing floor at Columbia University's Presbyterian Medical Center. From 1945 to 1949, she was a faculty member at Yale University. It was while she was there that a very interesting event took place that influenced the rest of her career. In the position as graduate instructor, she was required to teach from the book 120 Principles of Nursing Practice. This book was published by the National League of Nursing in 1937 and was part of the curriculum. The students questioned the principles, and Abdellah could find no scientific basis for the guidelines. Because of this, she gathered her colleagues in the university courtyard and burned the books. She later recalled that the dean required her to pay for the books, and it took her a year to do that, while only being able to afford to eat peanut butter sandwiches. In remembering this incident, she did say that she has mellowed since then, but that sometimes you have to create a revolution. She respected her students for questioning the scientific basis for procedures and spent the rest of her life questioning and researching the science behind nursing practice. This experience inspired her to study physiology and receive a master's degree in 1947. And she also received a doctorate in education. In 1949, Dr. Abdellah met Lucille Petrie Leon, the founder of the Cadet Nurse Corps and later the first woman Assistant Surgeon General of the U.S. Public Health Service and Chief Nurse Officer. Due to Leon's influence, she decided to join the Public Health Service Commission Corps and spent the next 41 years in their service. Her first few years, they were spent performing studies and research in numerous hospitals to improve nursing practice. During the Korean conflict, Abdellah was on active duty as part of the Navy and worked with the Korean people as well as those in other countries teaching them to deal with various public health problems. As a senior officer, she was able to advise and assist them in a number of studies. Her 41-year career in the public health service was filled with many achievements. She served as the chief nurse officer and became the first nurse in any service to receive the rank of a two-star rear admiral. In her position as Deputy Surgeon General, she made changes in many vital areas of public health, including those of drug addiction, alcoholism, AIDS, smoking cessation, violence, mental illness, and hospice care. She was very interested in gerontological care and worked very hard to establish nursing home standards in the 1970s. After retirement from the Public Health Service in 1989, Dr. Abdellah founded the Graduate School of Nursing at the Uniformed Services University in Bethesda, Maryland in 1993, and she was the first dean. It was the only federal graduate school of nursing in the United States. In addition to her duties there, she conducted international workshops on nursing care and research. After more than 50 years of service to the government, Abdullah retired in 2002. She has received over 70 honorary degrees and awards, including the 1994 Living Legend Award given by the American Academy of Nursing. In 1999, she was inducted into Columbia University's Hall of Fame. In 2000, she was named to the National Women's Hall of Fame, and in 2012, she was inducted into the American Nurses Association Hall of Fame. She continued to work well into her 80s, contributing to the body of nursing research and knowledge.
Overview of the 21 Nursing Problems Theory. The 21 Nursing Problems Theory was developed by Faye Glenn Abdellah. Her model of nursing was progressive for the time in that it refers to a nursing diagnosis during a time in which nurses were taught that diagnoses were not part of their role in healthcare. The 21 nursing problems identified in the nursing theory are comprised of 10 steps used to identify the patient's problems and 11 skills used in developing a treatment typology. The 10 steps to identify the patient's problems are: first, learn to know the patient. Second, sort out relevant and significant data. Third, make generalizations about available data in relation to similar nursing problems presented by other patients. Fourth, identify the therapeutic plan. Fifth, test generalizations with the patients and make additional generalizations. Sixth, validate the patient's conclusion about his nursing problems. 7. Continue to observe and evaluate the patient over a period of time to identify any attitudes and clues affecting his behavior. 8. Explore the patient's and family's reaction to the therapeutic plan and involve them in the plan. 9th, identify how the nurses feel about the patient's nursing problems. And lastly, discuss and develop a comprehensive nursing care plan. The 11 nursing skills in the theory. First, observation of health status. Second, skills of communication. Third, application of knowledge. Fourth, teaching of patients and families. Fifth, planning and organization of work. And sixth, use of resource material. Seventh, use of personnel materials. 8. Problem solving. 9. Direction of work of others. 10. Therapeutic use of the self. And lastly, nursing procedure.
The four meta-paradigms of Faye Abdallah's 21 Nursing Problems Theory. Person. Abdallah describes people as having physical, emotional, and sociological needs. These needs may be overt, consisting of largely physical needs, or covert, such as emotional, sociological, and interpersonal needs, which are often missed and perceived incorrectly. The patient is described as the only justification for the existence of nursing. The individuals, as well as their families, are the recipients of nursing and health, or achieving of it. It is the purpose of nursing services. Health. As stated in the previous slide, health, or achieving of it, is the purpose of nursing services. Although Abdellah does not give a definition of health, she speaks to total health needs and a healthy state of mind and body in her description of nursing as a comprehensive service. Abdellah describes health in patient-centered approaches to nursing as a state mutually exclusive of illness. She also states that emphasis should be placed upon prevention and rehabilitation. A holistic approach must be taken by the nurse to help the client achieve state of health. However, the nurse must accurately identify the lacks or deficits regarding health that the client is experiencing. These lacks or deficits are the client's health needs. Environment. The environment is implicitly defined by Abdellah as the home or community from which patient comes. Society is included in planning for optimum health on local, state, national, and international needs. These includes their rooms, home, and community. However, as Abdellah further portrays her ideas, the focus of nursing service is clearly the individual. Nursing. Abdellah states that nursing is based on an art and science that mold the attitudes, intellectual competencies, and technical skills of the individual nurse into the desire and ability to help people, sick or well, cope with their health needs. In theory, the goal of nursing is the fullest physical, emotional, intellectual, social, and spiritual functioning of the client, which pertains to holistic care. It can be said that nursing is a helping profession. In Abdallah's model, nursing care is doing something to or for the person or providing information to the person with the goals of meeting needs, increasing or restoring self-help ability, or alleviating impairment. Based on the theory, nursing is broadly grouped into the 21 problem areas to guide care and promote uses of nursing judgment. These would mean a comprehensive nursing service, which includes recognizing the nursing problem of the patient, deciding the appropriate action to take in terms of relevant nursing principles, providing continuous care of the individual's total health needs, providing continuous care to relieve pain and discomfort, adjusting total nursing care plan to meet the patient's individual needs, helping the individual to become more self-directing in attaining or maintaining a healthy state of mind and body, instructing nursing personnel and family to help the individual, helping the individual to adjust to his limitations and emotional problems, and working with allied health professionals in planning for optimum health. This means that it would need carrying out continuous evaluation and research to improve nursing techniques and to develop new techniques to meet all the health needs of the people. Thank you all for listening. Once again, this is Group 3 presenting the 21 Nursing Problems Theory by Faye Glenn Abdellah.